Good afternoon, everyone. We're here a little earlier today. I'm here with Veronica Santarelli. I hope I said that right, Veronica, in Grassp Health. So we're going to talk a little bit about medicinal marijuana and assisted living. So Veronica has been very present in the Arizona market, and I've seen her at quite a few events, and I know she was active in the California market and getting involved probably again shortly. But there's just a lot of misconceptions and misunderstandings in the industry, and I wanted to make sure that if there was something that came up in your own home, maybe somebody was prescribed cannabis and you didn't know how to handle it, or you didn't understand interactions between medications they were already on, or why somebody would be prescribed it, that Veronica could maybe clear up some of those questions you guys had. So I'm hoping today is very enlightening and we can all learn a little bit from you. So I'm going to hand things over to Veronica, and I'm going to turn my camera off.
Thank you so much, Molly. Appreciate it. Yeah. So it's nice to virtually meet everyone. My name is Veronica Santarelli. Our company is Grassp Health, and we do a few things. I wonder if I can. Slideshow doesn't seem to be working. Not sure why. There we go. Okay.
Oh, there you go.
That's better, yeah. So what we do a few things. We do science-based education. A big myth out there is that and you'll hear this from physicians, is that there isn't enough published research on this topic, but we will be reviewing a lot of the published research, and I think it's important that people understand that this is not anecdotal anymore, that there is a lot of science to draw on, and that's exactly what we do. We do the delivery to homes, to assisted living communities, to people in private homes. We do specific dosing recommendations for chronic health conditions, and then we help create policies, both on a legislative level and on, for different communities that we work with, so that residents that are in your communities can benefit. Now, the policies that we've created are specifically for Arizona, so I'm going to speak about the laws and the qualifying conditions here. I will say that Arizona does have a program that is very robust, and a lot of other states that have implemented programs have utilized other states' programs. So you will see, if you live in a state that has a medical cannabis program, a lot of times it will have little pieces from other states' programs that make sense and that they want to implement. Arizona has arguably one of the most regulated medical cannabis programs in the nation. Recreational states have an even higher level of regulation, just because they're serving, anybody over 21. It's very regulated for the medical community here. Before recreational got implemented in the 11 states it's in now, Arizona was definitely the most regulated medical marijuana program that existed in the nation. I just wanted to talk briefly about the anatomy of the plant. Because a lot of people right now are using CBD oil. I'm sure you've seen it in your homes, heard people talk about it. If cannabis is not used and discussed in your community right now, I'm sure you have family members that are sneaking this in. But the great thing about CBD is it's non-psychoactive, and a lot of seniors that I talk to are like, I want the good one, I don't want the bad one. And what they're talking about is they don't want the kind that gets you high, they want the CBD that they've heard is safe to use and doesn't cause a high. So if you're looking at this plant, the one to the right is the hemp plant. And it's grown for that big, thick stalk right there that happens to be very high in CBD, which is the chemical that is not psychoactive. It doesn't get you high. And to the left is that very dense bud. So that is actually the flower of the plant. It's this little flower that comes between these big broad leaves. And that part of the plant, the bud or the flower that's to the left, is what people traditionally think of as marijuana or pot or weed. It's what's ground up and smoked. It's also arguably the most medicinal part of the plant because that bud or flower has hundreds of chemical compounds that are therapeutic. The stalk is mainly, it's high in CBD, naturally low in the psychoactive chemicals, THC. And it's also used for paper and for clothing. The stalk will have all kinds of different uses, but the medicinal parts are either the CBD or the THC that we're going to talk about today. So in Arizona, this is a list of the qualifying conditions. Now, anybody throughout the nation right now can use CBD because CBD is now federally legal. That's one of the reasons that you see it sold everywhere. You see it in convenience stores, you see it in farmers markets. I mean, everybody's selling CBD right now. You do want to be careful about where you buy your CBD. You can buy it, like I said, anywhere, but not all of it is medical grade. Not all of it is safe. You need to know the right questions to ask, which we'll discuss later. These qualifying conditions are if you want to get a card for THC. Now, if you're in a state like California or Colorado or Chicago, you have recreational access. So you don't have to have a medical card to go and purchase cannabis. But in a state like Arizona, where we don't have recreational access, you have to pay the state $150 to get this medical card. You also have to pay a doctor about another anywhere from $80 to $150 to get them to write the certification for you. Not all doctors do it right now. There are some doctors that specialize in this. A lot of doctors that specialize in it happen to be naturopaths because they've been educated in plant science. So the qualifying conditions in Arizona, there will be a lot of similarities state to state. So I want to say, I'm trying to think of the state that just added chronic pain. It was a little shocking to me that chronic pain wasn't already there because in Arizona anyway, about 85% of our certifications come from a chronic pain diagnosis. And here you're able to get a medical card for anything that causes chronic pain. A lot of common ones that we see are migraines, arthritis, fibromyalgia, back pain, neuropathy, orthopedic issues, gastrointestinal issues, traumatic brain injury, really anything that causes that diagnosis of chronic pain can qualify for a medical card here in Arizona. Other common ones are cancer, glaucoma, AIDS or HIV, hepatitis C, ALS, Crohn's disease, agitation from Alzheimer's disease, wasting syndrome, severe nausea, seizures, anything that causes severe and persistent muscle spasms. We see Parkinson's, Huntington's, and MS quite often. Those are probably the most common. And then PTSD. Now, all of these conditions have scientific published research proving efficacy. Not all of them have robust clinical trials, but a lot of them do. So we'll review which ones have published clinical trials. A couple other qualifying conditions. A lot of people use cannabis for anxiety. That is not a qualifying condition here. In a recreational state, you can use it for that, but not in Arizona, at least. You can't use it for insomnia. We are trying to get autism added to this list. We haven't been able to pass that yet, but and what you will find is in your communities, you're probably taking care of people that have multiple conditions. So most people that have Parkinson's or dementia or MS, a lot of them do have chronic pain. A lot of them have arthritis. So a lot of times you'll see comorbidities. So this is all terminology about why cannabis is a medicine. So it all has to do with that. It's a receptor system called the endocannabinoid system. And with the endocannabinoid system, all mammals have this system. And it's a cell receptor system found all throughout the body. And the two receptors that they found in this system were called CB1 receptors and CB2 receptors. And what happens is when we when our body needs homeostasis, chemicals bind to these receptors and allow for homeostasis. So cannabinoids are the chemicals that bind to these receptors and act as neurotransmitters and allow our body to get back to balance. There are 3 types of cannabinoids that exist in nature. We produce our own endogenous cannabinoids. So we make chemicals. There's 2 of them that were discovered that bind to our receptor system. And they're called 2-AG and anandamide. Now, when we suffer a loss of our own endogenous cannabinoids, we need to supplement with them. And we can supplement with either the other 2 kinds of cannabinoids, phytocannabinoids or synthetic cannabinoids. Phyto or plant cannabinoids are what's found in the cannabis plant. THC and CBD, those are both phytocannabinoids. And actually THC is almost a direct replica for the internal chemical that we produce called anandamide. And CBD is almost a direct replica of the endocannabinoid that we naturally produce called 2-AG. So these plant chemicals, THC and CBD, are almost exact replicas of the chemicals that we make ourselves. Now, there are synthetic cannabinoids. Marinol is probably the most well-known. If any of you have had a lot of experience working with cancer patients, you might have seen one of them or some of them prescribed Marinol. Marinol is a synthetic version of THC. Now, what's important to understand is that a synthetic cannabinoid will always have more side effects than a natural plant cannabinoid. And that's because a synthetic cannabinoid is just the chemical compound THC. They haven't made synthetic CBD. They only have replicas of THC found that are made by pharmaceutical companies. And dronabinol is one of them, Marinol is one of them. And they're very harsh. They cause a very harsh high, and they have a lot of other side effects. The reason that plant cannabinoids or plant chemicals or the medical marijuana is more natural to the body is because there's something called the entourage effect that happens. And remember that picture that I showed you of this bud right here to the left? That bud has hundreds of those chemical compounds in it. Besides just CBD and THC, it has something called terpenes. Terpenes are basically essential oils. So what they do, those essential oils also have therapeutic effects. Right now in hospitals, they're using essential oils for anti-nausea and a lot of other antimicrobial, antifungal. I mean, they add essential oils to a lot of cleaning products because of those antibacterial and antifungal properties. A lot of these essential oils have anti-inflammatory benefits or anti-cancer benefits, along with hundreds of other cannabinoids, CBN, CBG. Again, it's very complex. And that's why a lot of physicians at first, didn't feel comfortable with it. They're used to synthetic chemicals that are exact replicas. Well, we saw with the opioid crisis what happens. You have to keep increasing the dose to get that same level of pain relief. Well, when you're using all those hundreds of chemicals in this plant that are acting synergistically and balancing each other, you get a much more balanced effect. The other thing that's important is that CBD will balance the psychoactivity of THC. And that's important. With a synthetic cannabinoid like a Marinol, you don't have any other plant chemicals balancing that. It is just the THC chemical compound. So let me show you an image of this. So if you look to the right, this is the endocannabinoid system. So it's made up of those 2 receptors, the CB1 receptors, the light blue, and then the dark blue CB2 receptors. So this is our receptor system that's found throughout our body that binds to the chemicals in that plant. And where you have an activation, you have a therapeutic effect. So the CB1 receptors are primarily found very densely populated in the brain. In fact, there are more cannabinoid receptors in the brain than opioid receptors, which is why it's phenomenal for pain management. Look where those other CB1 receptors are, all down that spinal cord. So the central nervous system is greatly impacted by those CB1 receptors. The gastrointestinal tract is another very dense area of those CB1 receptors. And also throughout the peripheral nervous system. So for people with neuropathy, you have receptors all the way down to your hands, your feet. Again, that's why people with neuropathy, a lot of times they say nothing really works as well as cannabis. The CB2 receptor, the dark blue, is mainly associated with immunity. So you're going to find the CB2 receptor on white blood cells. You'll find CB2 receptors on some of the major organs associated with immunity. You'll also, what they've found through the research is that when you get injured, CB2 receptors will form on demand so that you can heal faster. So the THC is in light blue as well, because THC is what binds directly to that CB1 receptor. So for people with neurological conditions, people with really severe spinal stenosis or spinal pain, a lot of times they do need that THC involved, because THC is the biggest pain reliever, and it binds directly to that CB1 receptor. So it's the tighter that the chemical binds to the receptor, the more therapy, the stronger the effect is. CBD is more associated with that CB2 receptor, but it does not bind directly to that receptor site. So you don't get a high at all from CBD. They're still looking at the mechanisms of action of CBD, but what we know is it helps to coat the CB1 receptor so that the THC doesn't bind too tight to it. So that's why when you're using CBD and THC together, you get a much more balanced effect. In Colorado, there was a gentleman, like a 90-year-old gentleman, who was given a pure THC lollipop. And this was somebody with a heart condition. He had like heart attacks, and really that was too much THC alone for that gentleman. He should have been given something with his condition, with his age. He should have been given something that balanced with CBD, because he got way too high, way too paranoid, and that was not a good effect for him. So when these chemicals bind to your receptor system, they act as neurotransmitters, and they communicate to your body what you need for homeostasis. This is what's been discovered by scientists. It was first discovered by a scientist in Israel, and a lot of other research is coming out of Israel and the UK and Spain, and a lot of these countries that don't have the same federal prohibition on research that the US does. So CBD, cannabidiol, is the technical scientific term. So what does it do? Well, CBD is a very powerful anti-inflammatory agent. So it reduces inflammation. It's an anxiolytic, it reduces anxiety, it's a neuroprotectant. It protects brain cells from deteriorating. It calms the nerves. It's an antidepressant. It's an anticonvulsant. So it controls seizure activity. That's actually, the little girl Charlotte that was helped pass medical cannabis legislation in Colorado. That's what Charlotte's Web, that plan. A lot of you out there might have heard about the very popular brand Charlotte's Web. That's a very potent CBD oil, and because it reduced seizure activity in this little girl Charlotte who had like 300 seizures a day. Now CBD does come in pharmaceutical grade. It's not a synthetic though. It's actually natural CBD. That actually passed. It's called Epidiolex. So for any of you out there that live in Kansas or Idaho or some of these states that just don't have a cannabis program at all right now, your doctors, if you have somebody with if you know anybody with a child with intractable seizure disorder, This passed clinical trials in the US for intractable pediatric seizure disorder, and it's CBD in pharmaceutical form. It's very expensive, but it is covered by insurance. I don't know how much the out-of-pocket would be, but I think it's like $37,000 a year covered by insurance. But again, I don't know what the out-of-pocket is. Natural CBD is obviously a lot easier to access, and it's federally legal. So you can order it online, you can have it shipped. You do want to make sure that whoever you're getting it from is lab testing it. They show the lab test, because you don't want to be paying for a medicine that has heavy metals in it or that doesn't have the amount of CBD it says it does. It does produce calm. I wouldn't say it's a strong sedative. I should probably remove that. I think a lot of patients do say that they sleep great with CBD, although there's other patients that feel like it's stimulating to them. I will say it does promote calm in terms of anxiety. So if you're somebody that's ruminating at night and you can't stop thinking about things because you're anxious, it definitely can promote that calm to help you sleep. And it's non-psychoactive, so it doesn't produce a high. Right now, the Epidiolex, the pharmaceutical grade, is a Schedule 5 drug with high medicinal value and low chance for abuse. And it balances the psychoactive effects of THC. So like I said, if somebody's had way too much THC and they have a very bad high, then you can give them CBD to help bring them down from that high. Anybody that we talk to that's a senior, typically we're giving them a much higher ratio of CBD to THC, at least until we understand how they tolerate THC. THC, tetrahydrocannabinol, what does it do? So this is the most studied chemical compound that exists right now, although a lot of the research that's been done in the US has been to show harm or how it can harm. But through that research, we found that it really plays well with other drugs. There aren't any major side effects. And then some of the really exciting research has come out of, like I said, Israel and the UK. But what we do know, and there have been at many colleges and institutions around the United States, there has been some clinical trials that have been done proving that THC is a very strong analgesic. So it's the #1 painkiller in the plant. Now, some people do have a reduction in pain from CBD. What we do know about CBD is it boosts your own anandamide levels. So it boosts your own natural endocannabinoid production. And since anandamide is a natural endocannabinoid that is for pain relief, some people do have great pain relieving effects from CBD. But some people that I talk to, they've tried CBD and they're like, this doesn't even touch my pain. And those are the people that need to get a medical card and need to use the THC. So it's a very strong analgesic. It is a very strong sedative. So for some people, they love that and they use it specifically for that. And for others, that could be a side effect during the day. So we'll give them a much lower dose during the day. It's antiemetic. It decreases nausea and vomiting. That's why a lot of oncologists recommend THC to their patients. Also to boost the appetite. So it's a very strong appetite stimulant. Again, side effect for some. That's sometimes the reason that an oncologist is prescribing it. It reduces depression. It's phenomenal antispasmodic. A lot of phenomenal clinical trials regarding THC came out of some of the UK clinical trials for MS. There are anti-tumoral and anti-cancer properties. This has been displayed in lab and rat models, showing that it creates apoptosis in cancer cells. There's a lot more research to be done. There are clinical trials happening in other nations. However, a lot of times right now, THC is being used for the side effects of cancer and the side effects of treatment. But what we do know, because there are anti-cancer properties to them, that they can make for a much more effective treatment plan. There's definitely more research to be done because some cancers are much more inclined to have a positive response to THC, like breast tumors and prostate cancer. And then there's others like brain tumors, all those CB1 receptors up in the brain. You can see why certain types of tumors have a better response. And then it is intoxicating or psychoactive, especially at 10 milligrams or above. And some people though are very sensitive to THC, and even 5 milligrams is too much for them. So microdosing is very, very important. So this is all published research on cannabinoid efficacy. This is scientific research. This has been done by peer-reviewed physicians and scientists all around the world. Neuropathic pain is one of the conditions that does have robust clinical trials. The neuropathic pain from spinal cord injury and disease, ALS, the Mayo Clinic, we talked to one of the ladies that runs the ALS clinic, and she said that for the muscle spasms associated with her ALS patients, nothing really worked better often than cannabinoids or cannabis. Cannabinoid receptor 2 is a potential therapeutic target in rheumatoid arthritis. So UCLA and a lot of institutions are doing clinical trials right now on rheumatoid arthritis. This already has clinical trials done by UCSD. So rheumatoid arthritis, inflammatory pain is one of those conditions, like I said, that does have clinical trials done on it. The anti-tumoral properties of cannabidiol, so CBD, on human breast carcinoma. There are a lot of clinical trials now in the US happening with CBD since the federal restriction on CBD has gone away. Overall anti-cancer mechanisms of cannabinoids, therapeutic targets for migraines, Crohn's disease. I have a patient here who cannot keep food down, and inhaling her medicine for her Crohn's disease is the only thing that will work. Multiple spasticity management and multiple sclerosis. I work with a 90-year-old former nurse who, again, she'd never heard of cannabis and how it can help multiple sclerosis until I presented to her and her little group of other retired nurses. And she only needed tiny dose, and she was very sensitive to THC, and it greatly helped to reduce her muscle spasms and the other symptoms that she had. Regulation of nausea and vomiting, stroke and brain trauma. One of the reasons I got into this industry was because my grandmother had a horrible stroke, lost her ability to speak. I was desperately trying to find something that would bring back her speech. And this is 20 years ago, so this is before we knew what CBD was. If I knew then what I know now, I would have given her high doses of CBD oil, because they're showing that can help calm all of that activity in the brain and mitigate some of that brain damage. Promising cannabinoid therapies for Parkinson's disease. There's a lot of clinical trials happening with Parkinson's disease. It's phenomenal for the rigid muscles and the tremors. That's definitely what we're seeing. Let's see, the post-traumatic stress disorder. So in Arizona, we have a scientist, Dr. Sue Sisley, who just published a double-blind clinical trial for PTSD on combat veterans, and showed tremendous efficacy for that disorder. And then TBI, traumatic brain injury. If you go on our website and you look under the Learn More section, you will see a patient testimonial. This gentleman who, his family wouldn't let him use cannabis for over a decade, even though, his neurologists all recommended it to him because he was having such horrible side effects from all the pharmaceuticals that they gave him. And he actually gained back reproductive function when he started using cannabis, which was not something that his family looked for. But what we do know is because of where the receptors are in the brain, sometimes people do have really dramatic returns because it improves synaptic transmission. So for areas of the brain that maybe those signals weren't connecting, suddenly they're connecting again. And some people start speaking again. So, we've had autistic kids that have started speaking again that we worked with in San Diego. So again, some people don't tolerate cannabis well at all, and they don't use it because of that. And then some people have miraculous effects. The bell curve is that it does help for a lot of people. It's kind of the outliers on either side where you have those miraculous benefits or you have some negative side effects. But for the majority of people, we can understand kind of what's to be expected in general from how they'll respond to cannabis. I feel very strongly about cannabinoids for dementia. A lot of you who do manage residential care homes, I'm sure you have patients with agitated dementia. Everybody's life gets better when you use cannabinoids with dementia for many patients. A lot of times when, you know, the calls, so the first study was done with a synthetic cannabinoid for nighttime agitation. And we all know with sundowning effects that those, you know, whether it's extreme violence or agitation, hitting, punching caregivers that are just trying to shower the resident, you know, that can lead to a lot of issues for both the family, getting calls in the middle of the night. It's and what we do find now, the other two studies that you see here all have to do with the amyloid plaque buildup. And what they found was cannabinoids can help reduce and remove that trademark of Alzheimer's disease, which is the amyloid plaque tangles and buildup. And whether that leads to Alzheimer's or not, what we do know is that neurodegeneration, the dying of those neurons, can be slowed down by cannabinoid use. So if somebody has an early diagnosis, you know, they can help mitigate the onset of it. Cannabis right now is used as a last resort most of the time. So usually people are very advanced in their disease, and then nothing else is working. You know, the next video I'm going to show you is a woman who was moved to 6 different geriatric psych wards because she was so agitated. This poor woman, she was given every drug under the sun and had horrible side effects, and this was a last resort for them. And it really proved to be life-changing. So I'm just going to play this. It's just a 60-minute video.
My wife was diagnosed with early onset Alzheimer's. As the disease progressed, she became increasingly agitated and aggressive. Part of the problem was that she turned out to be allergic to antipsychotics. So we were to the point where we're getting desperate in terms of our abilities to control her behavior. And one of the doctors said, hey, why don't you try medical marijuana as an option? So we were able to get a prescription for it. Grassp turned out to be a godsend. She's no longer aggressive. Her anxiety levels are down. She's eating more, so she's going back in the right direction. What you have to try to do is make it as painless as possible, make their lives as rewarding as you possibly can before it ends. And this has helped.
So what we know about a lot of the pharmaceuticals out there is that they cause other side effects, right? Opioids cause a lot of constipation, addiction, death. A lot of the antipsychotics that they give Alzheimer's and dementia patients make them zombies, and they have horrible side effects. With cannabis, it's so different because you're addressing the main issue, or the main symptom, which is either agitation or extreme anxiety. But what we see is that a lot of other positive side effects come from this. They sleep better. They start eating better because their appetite's boosted. They socialize better. They get along with other residents better. And just the quality of life is enhanced. So that's why I feel really very passionate about that topic. I don't think anybody suffers more than, you know, the family members and the patient themselves as they're going and they're progressing in that disease. And I think it should be used as a first line of defense. Opioids and cannabinoids, I do want to touch on this because there are some drugs that you want to separate from cannabinoids. Opioids is not one of them. Opioids actually can increase the analgesic properties of an opioid. And look, you know, nobody loves opioids, but opioids have their place, especially in hospice care. And some people have such a level of pain that a small dose of an opioid is appropriate. But you can't keep increasing that dose. There's now a lot of legislation out there preventing that from happening unless you're under pain management. And we unfortunately have a lot of pain management doctors that are forcing patients to choose between cannabis or their opioids. And we want to show them that there's a lot of published research right here that show that they actually work synergistically, and you can greatly lower the opioid dose as you add in a small dose of cannabis. That last study right there took a transdermal fentanyl patch, reduced the amount of fentanyl, added a small amount of THC, and it increased the analgesic properties and increased the safety profile of the drug. So the future, once some of this restriction on research goes away, the future will be combination drugs. So these are the different methods of administration and typical onset. The communities that I work with are typically non-smoking. So the policy I typically create for assisted living communities is a no smoking policy. But there are some that do allow it in, outside in a certain area. But edibles, oils, they're very popular. Edibles can come in all kinds of different varieties: capsules, gummies, chocolates. The thing you want to be careful with edibles is it takes longer to digest and break down. So 45 minutes to up to 2 hours for an onset. So usually 45 minutes to an hour is pretty common unless somebody has a very slow metabolism. People that have been heard in the news having really bad experiences with cannabis, typically they ate a piece of an edible, 10 minutes later, 20 minutes later, didn't think it was working, ate another piece, maybe 20 minutes later, ate another piece, and then they've had 3 doses and then it hits them and then they feel horrible. The great thing is that you're not going to die from cannabis. Cannabis, you can't overdose on it. You can feel horrible if you take too much. But you will come out of it and you will survive. It's not like an opioid. Oils, sublinguals, oils are great. They are great for microdosing. If you're taking the oil as an edible, you're going to have the same, onset time. But if you're taking it sublingually, drops under the tongue is very popular, typically 20 or 30 minutes for an onset. Topicals, unless it's a transdermal patch, it's not going to get into the bloodstream, so you don't have to worry about drug testing unless you're using a transdermal patch. But creams and ointments are wonderful. I met a woman with cancer that was using 300 milligrams of topical to help her symptoms. People with psoriasis or arthritis, these are great because you're not going to get an additional high from it, and they can be used very freely. Suppositories are great for patients with extreme nausea. And then, of course, inhalation through vaping or smoking is always an option. Inhalation is immediate, so it is easy to titrate. As far as dosing, you always want to start low and titrate up slowly, just like with any other drug. THC versus CBD dosing is very different. THC, you're going to do microdosing with anywhere from 1 to 5 milligrams at a time. CBD dosing, you typically can do much higher. Usually with somebody, with just general anxiety or general inflammation, could use anywhere from like 20 to 30 milligrams a day. But for serious pain, if you're just using CBD alone, you might need 100 milligrams. If you're treating a seizure disorder or cancer and just using CBD alone, you might need 300 milligrams. But THC is very different. THC is so strong because it binds directly to that receptor that you typically need a very small amount of THC to get a therapeutic effect. So we use a lot of tinctures because you can do milligram by milligram in case somebody tends to be sensitive to medications. With gummies or edibles, we're typically starting anywhere from 2.5 to 5 milligrams for a dose and finding edibles that also have CBD in them. Topicals, again, these can be used freely, typically a dime to a nickel size, depending on the size of the affected area. Transdermal patches can take 8 to 10 hours can provide 8 to 10 hours of relief. We have transdermal patches that last 3 days. And then inhalation, typically the onset is immediate and the duration, it lasts for usually 2 to 3 hours. So if people are inhaling their medicine, a lot of times they need to dose themselves more frequently, whereas an edible can last 5 to 8 hours in the system. So for people with chronic pain that need that longer level of medicinal effect, edibles are really great for that. As far as drug interactions and possible side effects, what we do know from the research is that cannabis plays really well with other drugs. The only thing that you want to watch out for is with CBD, because CBD is broken down by that same P450 liver enzyme that breaks down a lot of drugs like some blood thinners, antipsychotics are one of those classification of drugs that typically are broken down by that liver enzyme. If the pharmaceutical says avoid grapefruit, you just want to space it about 2 to 3 hours from CBD. And the only reason it's not going to have some crazy harmful interaction, it's just the metabolizing issue. It may slow down the metabolizing of that other drug. And, you know, with like chemotherapy drugs, you don't want chemotherapy lasting in your system longer than the doctor wanted it to, because some of those drugs can be very toxic. Sedatives, you know, THC is a natural sedative. So, you know, again, you're not going to die if you use it with something like Ambien, but you definitely can reduce the Ambien or take it away completely, typically, if people are using THC. Opioids can be greatly reduced in dosing once you're using THC along with it. The side effects of THC, you know, THC has the most side effects, I'd say, especially if you're just using it alone and you're not balancing it with CBD. So if you take too much CBD or THC, it can cause anxiety. It can cause agitation and paranoia. It can increase your heart rate. So that's why you never want to give THC alone to somebody that's had a lot of heart attacks or has heart issues, dry mouth, redness of eyes. Headache in some people. But again, if you're doing a very low dose and you're balancing it with CBD, you get almost none of these side effects. So again, balance it with CBD is the goal, especially if you're using a medicinal application. High doses of CBD can cause some loose stool. That's really all we haven't found too many side effects with CBD, which is great. Obviously, that's a lot better than constipation from opioids. This is the statute in the Arizona Medical Marijuana Act specific to facilities that give them the ability to store and administer it. So if you're in a state that has an active medical cannabis program, most likely it's your health department that regulates it. I pulled this directly off of the Arizona Health Department's website, and it basically says that you can, the community can say, yes, we will store it, or no, we're not going to store it. They can decide if their caregivers are going to administer it, or they can say that they are not allowed to. Basically allows them to create a policy for all of these stipulations, that they need to use that smoking's not allowed, that they have to use it, you know, only in a very specific place in the community. So we use these guidelines and worked with a cannabis attorney and a healthcare attorney to put together a policy that passes all state inspections. And it's really important, you know, that when I first got here, it was don't ask, don't tell. You know, families were sneaking it in. There's no need for that if you have a legal program. You just want to make sure that you have a policy and you're following it, at least here in Arizona. Now, it may be a little bit different state to state, but you'd want to call your health department and you'd want to review the policies that are specific to facilities. For us here in Arizona, this is kind of step-by-step instructions for assisted living communities. We provide a customized cannabis policy for the communities that we work with. We do that free of charge because we want residents to be able to have access to this if their doctor thinks it's appropriate or their families think that they can benefit from it. We get a lot of referrals from nurses, people that have had education and understand that this might be suitable for this resident. And if you have an existing cannabis policy already set up, you're ready to welcome that resident in. Here you have to have a qualifying condition for Arizona if you're using THC. We have a network of mobile physicians that we work with that can visit the community to certify them. Again, if you're in a recreational state, you might not need a medical card, but here you absolutely do. And we also work with the physician that does certify them to provide the dosing, the doctor's order basically, because when our communities get inspected, the inspector is going to want that order from the doctor saying, how many milligrams is this person taking? How many times a day? Because we've studied with scientists and physicians that specialize in this, we've become specialists, and we often help the doctor with these dosing and product recommendations. And then we just make sure that the community is compliant. We have never had one issue. We probably work with about 100 different assisted living communities here in Arizona, and we've never had a citation or any issues at all. Right now the state has gone to digital cards, and then we're able to deliver after that. Here, it is very common in the cannabis industry that you have to pay with cash. Unfortunately, we still face those federal banking restrictions. So, but our service is very professional. Our drivers wear buttoned up collared shirts. I think a lot of the stigma of the cannabis industry has painted this picture of degenerates and people that are, all tattoos, and that's just not the case anymore. We really want to professionalize it. We've done that here, and it's starting to happen all over the nation. This is our app. When you're using our app, you are getting medical grade lab tested products. If you are in a state that does not have a program, again, make sure that you are, if people are using CBD, if you want to allow CBD in your community, which you definitely should, it's federally legal, it's a Schedule 5, you just want to make sure that the patients are getting lab tested medicine. And then this is my contact information if you have any questions. I'm sorry, I went a little long, so we do have a few minutes for questions, but feel free to email me. That's our website if you want to go on there and look at the learn more and just get a little bit more education. But I can be reached anytime for any personalized questions. And I'm not sure how to.
I just was so overwhelmed with all of the information. That was so great. I love the way that you prefaced that with all of the information about cannabis in general and then talking about assisted living in the end. So I think that this really clarified, I hope it clarified for everyone what it was going to be. If someone comes into your facility and they have a family member, like she said, that is bringing them some kind of CBD or some kind of other product, that they can maybe go to their doctor or go to somebody that knows more about it and could provide some more help for them. So it's always nice to know that there's alternative options in this world of over medicating, and there's thousands of different drugs, especially drugs that seniors are on. So why not just educate yourself on alternatives? So I hope you guys enjoyed this, and please, please, please reach out. Like I said, Veronica's information is here. I'll send it to you again tomorrow. I'm also going to send this recording to you guys tomorrow. And just let me know if you have any questions or if you want to hear more, right? If you have specific, you think a whole nother presentation needs to be done, we're happy to have Veronica back. So let me know what you guys need, and I am so happy to provide it for you. Our next webinar is going to be on next Tuesday, which is June 16th, and that one's going to be at 5 p.m. Pacific time. We're doing it with caring.com, and caring.com has actually recently come up with a specific program specialized for residential care. So I'm very excited about that, and I'll see you guys next week. Thank you, Veronica.
Thank you so much. Appreciate it, Molly.